Good morning, dear colleagues. This is the Drug Delivery Information Forum, the platform where I'm welcoming you, I'm greeting you, and we're talking about issues of pharma, cosmetology, and veterinary issues. Thank you for joining us. And if you have a problem with the sound or picture, please chat to us, and my colleagues will try to respond. Everything going fine. We're going further just to synchronize the picture, the imaging, and the two screens. You've got to push the play button, and then in the left screen, and then the central one. Okay, this is our final online event in this year because in this year we have actually discussed many things, starting from packaging and sterilization and up to super drugs like multi-particular drugs, and you can see all the videos in our section in our column that is called online conferencing. And since the next year we're going to get offline, and the interventions will be only attended by Ukrainian companies, geographically speaking, but we're going to think about either we're going to stay with this online platform, and we're going to think it over on with what sounds to continue our broadcasting to the other countries, because we have a whole community set up in a year's time. So we wanted to continue to go on and work and visit with each other and share experiences. Let's get back to what we're doing today. I'm going to talk about the interfaces. Actually, all the buttons are intuitive. English and Russian is to switch your languages. On the left is the chat button for questions, and on the right is the agenda with the timing, and we'll try to stick to it. Today, our topic is very interesting, as was confirmed by the turnout, the registration. We're going to talk about solid dosage forms. 70% of all the drugs in all countries are being manufactured in solid dosage forms. So let's be pretty active in the questions and answers. Let's ask the questions to the speakers, and you can either write them into the chat box either during the presentation but or after the presentation, but please don't forget to address your question to a particular person. We got a list of participants that includes all the registered participants for you to be able to ask your questions after on completion of the event, just to familiarize with each other, introduce to yourselves to each other, and do some sort of matchmaking. And on the exhibition page, we got some virtual solutions that we have gathered together on our today's topic. And please make sure you use the chat button, chat window box. And let's get started. Yeah, I already said we're going to talk about solid dosage forms today and about the key manufacturing workflow stages and the production technologies. And I already said that 70% of all the drugs are in solid, coming in solid dosage forms, and it's very handy. And also the technologists already learned to disguise the unpleasant taste, if any, but there are some pressure points in the production that are still left. And today we have gathered together to discuss them and share experiences about some potential solutions. I'm going to invite our first speaker, Valentina Magiluk. She is a candidate in pharmaceutical sciences. Many people know Valentina from our conferences, and also her huge experience with the pharma sector in production. Valentin, he always speaks in a easy language about rocket science. It's not only theory, but it is solid dosage forms, solid forms, production experience, tableting, and all the other stages. And we're very grateful to Valentin. He always responds to our request, and he joins in and he talks about some very interesting matters that we're into. And Valentin, is over to you. How are you doing, Valentin? I'm I'm on air. I'm on air already, right, Svetlana? Okay. Good morning. You're interested in continuous solid forms production, and today, my presentation will have a focus on workflows and the equipment. Well, actually, it's necessary to have some vocabulary, like glossary, because we have uh, continuous production that is accompanied by feeding or unloading the product, and it could be actually continuous. It could be batch production with production stages with intervals between them, and in between the two extremes, like continuous, non-continuous. There are semi-continuous in between them that could be asynchronous work of several units of equipment, providing for feeding material in turn, taking turns, and there's a quasi-continuous also. It's a repetition of X number of times of the basic process. Now, what is actually a difference? The important difference between the stage rated batch, semi-continuous and continuous. Stage production is characterized by a pretty difficult modeling, complex modeling and scaling of the workflow, and sometimes the result cannot be impacted in the course of the workflow. And also the batch production. For batch production, it is typical to have large plant and large premises where this plant is situated. And in turn, continuous production gives one the possibility to control quality in the course of the workflow, which minimizes the expenditures on quality control and time included. Apart from that, laboratory and manufacture related batches could be performed with by means of the same equipment. So there are many questions you are relieved of connected to with scaling. And apart from that, a smaller equipment, smaller plant is less expenditures and less risk, less work on cleaning the equipment, and also it's quite economical for the premises and for the materials and for the rest of the things. And now I'm going to walk you over the continuous stages of the workflow. You are familiar with them; they're pretty familiar to you, and they might be also a little familiar to you. So let's get started. Actually, continuous processes. When it comes to continuous processes, we're faced with the need to continuously dose and mix the powders. For that purpose, special feeders are used, and the feeders are feeding powder into the mixer. And those feeders, from the point of view of design, can have one or two screws, and the configuration of those screws could be different. Apart from that, those feeders can also run with a vibro mode. And concerning the mixers can also be presented as two screw mixers or single screw mixers. Then we will see what else we got. And when it comes to this kind of continuous workflow, I will not talk about the particulars of that process because many of us, our specialists, already have the equipment and familiar with them. And let's talk a little bit about the continuous stages, about the continuous granulation in coders of fluidized bed. Now, about the design, those coders look like a pretty long chamber, and in these long chambers, there are there are nozzles, and the material is fed on one side and it's unloaded on the other side of the chamber, and then the material gradually moves from the entry point to the output, and it is sprayed by the nozzles, and it is dried by hot dry gas with air. And this chamber could also have some compartments divided. Could it be into compartments? And the compartments might include portholes or apertures, and those apertures are situated at a certain height, and the height of those apertures is related to the fraction of the material that moves from one compartment to the other. This slide visualizes the process, and there is a continuous granulation in the fluidized bed on this slide, and also it illustrates how this equipment looks alive. This was taken in Magdeburg at university, and you can see that's a pretty large piece of equipment, large plant, and I'm showing you actually the work chamber. Despite those processes are being used a pretty long time in food industry, as far as I know, neither in Ukraine nor in the rest of the world, this equipment became very popular together with the workflows. And apart from the continuous method, the processes of granulation and coating can be organized as quasi-continuous. For example, when it comes to the semi-product moves into one processing column into another, or by means of continuous feeding of a new portion of non-granulated material and continuous outflow of granulated material in a certain fraction with certain dimensions into the same that happens into the same processing column. Now concerning drying in fluidized bed, then if you take the analogy with the granulation and coating, what could be organized? It could be organized by continuous way or semi-quasi continuous, which is demonstrated in this slide. Actually, this method already became pretty popular when it came to continuous workflows, and they can see it further in this presentation. Design-wise, how it is all organized. About the processing column axes, the chamber is divided into certain compartments, and those compartments do radial movements as related to the vertical axis of the chamber, and then the chamber receives a portion of moist material, of damp material, and after a almost full circle around the axle, the material is dried by means of hot gas and it's unloaded from the column. Now, the next unit is dedicated to processes that could be organized by means of two screw extruders. First of all, I would like to say that this equipment and these technologies have moved into the pharma from polymer production and processing. Actually, extruders are being used a pretty long while, minimum 50 years. And in the pharmaceutical area, that's a pretty fresh trend. And this equipment was actually adapted to different workflows, which also includes two screw extruders that you could use to do a few types of granulation. So let's walk over them. First of all, it's wet granulation. That's a classical method. To use this method, we place the API and the excipient into the extruder, and after they're homogeneously mixed by means of screws of the extruder, then we feed via a certain porthole a binder in the extruder housing, and then they are homogeneously mixed. And then as at the output, we got wet granulate that afterwards needs to be dried. An alternative method is granulation by melting down. For that, we use a binder with a low melting point that's together with the API and the excipient, the filler. we load into the extruder, and the extruder homogeneously mixes them, and under the impact of the mechanical and thermal action in the extruder, the binder with a low melting point melts down and goes evenly over the surface of the ingredient, and then afterwards, after it cools down, they form granules. Then the third method that is illustrated in this slide is a high temperature meltdown granulation. And that's a pretty advanced new method that, apart from the granulation, includes the solubilization of the active ingredient. As a rule, it's different from the previous method of granulation by melting down, by using higher temperatures, because polymers are being used with a higher temperature, with a higher melting point or glass transition temperature. It is necessary to say a few words about the design and how exactly it is circulated by means of two screw extruders. There are single screw extruders on the market, but basically they have a little popularity, and they do certain jobs that we're not going to talk about those jobs in the presentation. Actually, the extruder with two screws has two screws, which is obvious. And those screws are equipped by paired elements, and those paired elements are same as they sit against each other, and they are seated on the screws, and depending on the design, the particular design, those elements do different jobs, and these jobs vary from moving the material, crushing, mixing, and so on and so forth. There's also elements that are different from each other, and they're different by having a free space that remains between the elements in a limited manner between the element and the housing of the extruder, and that influences the processing of the material and the moving efforts, moving strength during the circulation, during the processing. And unlike the batch production I've mentioned, the time of extrusion work under certain terms is very well reproducible, which substantially differences makes a substantial difference from the extruder based to batch production. So we can control and we can influence the parameters of the workflow, either influence and have an impact on the quality of the product and the quality of every load of material. Apart from that, material is also being processed depending on the particular modes, time varying half minute to several minutes, which is different from batch production, and that really influences those approaches to developing formulations. Well, let's move on. Actually, apart from the above mentioned granulation, two screw extruders can also do dry granulation, and the warmth, softening, and for the melting down of the material, and for the binder, the warmth, the heat goes not only from the jacket of the extruder, but also there's a generation of heat by friction of particles, because those extruders have jackets, and that jacket allows for different manners of heating up of different zones of the extruder. So when it comes to loading, we can leave a temperature that could be low to room temperature. I mean, in the zone that is close to the feeding zone, and in the middle of the extruder, you can set temperature necessary to do the technology to do the workflow that might include, for example, melting the material down. Now let's move further. Two screw extruders are pretty frequently used for the extrusion of a hot meltdown, and it's because there are very many active ingredients that are badly soluble, not very well soluble. And this method is to break the crystalline grate of that kind of substances to get also amorphous materials. So at the output, we get some cooled down polymer with dispersion in it, the API dispersion in it, which allows us to modify this, which is as a rule increasing the solubility of our active ingredient and as a rule increase its bioavailability. And this slide demonstrates two types of two screw extruders that are different by the location of their screws, because on the left we got a horizontal position of the screws and on the right we got a vertical one. Here it comes how they may fit into workflows, including on the right, as you can see, and then calibration and reduction in size and briquetting and encapsulating and dosing. But let's talk about drum coaters and continuous coating. And in the same manner as in the case of fluidized beds, we can see a much prolonged drum along which there are nozzles to coat, and the material is loaded up on the one side and unloaded on the other, and it's being dried by hot air. Nozzles could be differently set, basically, and as a rule, the last stage before getting out of the drum, that's tablets or capsules. They're not sprayed, but they're just dried by hot air. Just need to point out that continuous production is separate from analytical technologies. Analytical technologies allowing for controlling the homogeneity or the actual quantity of the API, also control the humidity and particle distribution of size, rheology, and many other things. Then I would like to switch to the fact that the above mentioned continuous workflows could be gathered and are being gathered and assembled as continuous production lines for certain kinds of products. And today we more and more often see publications in industrial and R&D papers and magazines that demonstrate the implementation of those concepts. And I'm going to cite three of them. And the first one, you can see a picture from the Swiss Novartis publication where we can see continuous workflows that include continuous feeding by means of feeders of powder materials. Then you can see also continuous mixing. You can see wet granulation. You can see quasi-continuous drying, then continuous calibration, tableting, and dedusting and coating. There's another example with a very interesting name, very tedious, 120 hours and 15 million tablets under continuous control. That's a publication by Merck and the British and Belgian colleagues, the GL group, that actually is presented as direct tableting with continuous feeding of all the ingredients except for magnesium stearate, then continuous mixing, then continuous magnesium stearate feeding, and then mixing, and then tableting. Actually, in the course of this process, it has demonstrated a pretty good robustness and reproducibility over 120 hours. Then the infrared sensor control the homogeneity and the active ingredient, paracetamol in this case. And also projected contents of the API in the tablets themselves. And the last publication is from FDA. And this is Industry 4.0 for pharmaceutical productions. This preparation for smart industries in the future. And FDA guys are sharing in this publication their vision, and they they give advice on continuous production and analytical technologies, and also the way how to store and distribute this information and how to analyze this information. Basically, I'm done with this. This is the end of my presentation. And just in conclusion, I would like to say that once transition into continuous production, from my point of view today, is already an obvious trend with its obvious advantages. And in my opinion, within the next couple decades, maybe just one decade, this trend will be followed, and those who follow that trend will set a competitive edge on the pharma industries, pharma companies. Thank you for your attention. Unfortunately, I can't hear Svetlana. So if you have questions, so please send them on my email or write on the chat box, and I will try to join in the chat. Thank you very much. Valentin, please stay for longer, and the end of your presentation now. I would like to ask that for we're going offline, and there are exhibitions, and we're going to live events, and sometimes suppose the situation is like the CEO of a plant or a pharmaceutical industry was inspired by the novelties after an exhibition, and they come back to the plant, to their factory, and they want a continuous production with like Elon Musk or somebody else. So what are the three questions that the chief technologist or the chief technical officer would ask that director for the plants to be ready for integrating the continuous production? And the second question is, what do they start with? Valentin. Did you hear Svetlana? It's just exhibitions. I will repeat the question, and my microphone was off. For example, there's an investor or CEO. Like he comes back from an exhibition and says, I want to be just as cutting edge and competitive and so on and so forth. So what are the three questions that a technical director or somebody else might talk about, might ask, just to understand if the company is ready as a whole for the technical transformation, and what the potential, what the capacity to start with. So what the question, what questions will they ask? Are they expected to ask? Actually, in my opinion, Most companies actually have made the first step towards it. According to the presentation that I've just provided, we already have a number of technological processes, workflows that can be engaged in a continuous or semi-continuous way. So we got basically something to start with, and we can work with them. We can understand how exactly we can process this whole information. If there is a transition to continuous production line, that's largely speaking is a interrelation of continuous processes in the workflow. So, for example, if there is virtual production that you're talking about, the technical directors, for example, and specialists operating these processes, if they get on well with the continuous technological stages and leave those technological stages work properly, if they're able to deal with those stages on a good level, then I can't see other reasons for why those stages could not be interrelated. And it's necessary to point out that in our companies, in our production companies, there's pretty that pretty not many technologies, analytical technology compared to a big Western company. So the use of those technologies in different microscopic sensors could allow us to relate and entice those technological stages in between themselves without waiting for the results to come back from the quality control or some other analyses. So this is why this is my actual vision about the fact and how to approach that and how to switch to it. Of course, gradually, by means of transferring the technological stages into batch-like production. But are there any things or courses to learn if you want to improve your qualification? But unfortunately, I don't know those courses. I just know that many pharmaceutical companies, pharmaceutical companies that are manufacturing technological equipment, and they are doing certain workshops where you can basically meet their particular equipment that either does one technological stage continuously or a few technological stages. You can mention here what quasi continuous dryer, Sigma or GLOT, that's integrated into the workflow of wet granulation with the use of an extruder. And that's known, that's possible. It is there, and about some training activities when it comes to continuous production, I never saw that. It was just to say that today we have representatives of pharmaceutical universities from our country, from Ukraine. So maybe they will listen to our opinion. Maybe they will do some continuous production chairs. I mean, for the training, and but actually, there are certain sections, certain units in companies doing. That's what I can see out here doing continuous production. Last ones I saw in Bayer in Germany, in European University. There are, I wouldn't say chairs or departments, but certain groups that are studying continuous production. That includes one group that I am working in, and we work with technologies related to two-screw extrusion. And that technology allows granulation and extrusion of hot melt down by means of 2-screw extruders. You can get immediate release formulations, and also you can have a disguising taste that will be disguised, and also soft forms and fizzy tablets, effervescent tablets could also be available. By means of just one unit of equipment, we can organize many workflows for different results, aimed at different results. This technology for today is actually going through quite an upheaval, but apart from that technology, there are different technologies that I mentioned. Some of them are more known, some less known, but altogether it moves towards continuous production, because there is a possibility to control in the course of the workflow every portion of discrete material is processed with reproduced characteristics, which really makes it different from the batch production, and that's a very big advantage that the big pharma has already used, because for them a transition into continuous production is not faraway plans, future plans, but it's a cause of today. It's today or tomorrow. So then, how our own companies will move in this direction, we're going to see. But in any case, you're available for a consultation, right? If something, yes, of course. Within my possibilities, within my competence, I will try to satisfy all the questions. Thank you very much, Valentin, that you have stayed with us, and I promise to fit into the agenda timing. So we're going to have some more speakers. We're going to have some more presentations. So I'll be very glad if you ask your questions by having your certain experience on continuous production, right? I will try to. I've tried as far as possible, but because I have a birthday. Thank you very much. We will try to listen to our next speaker, and this is just to make an introduction. I, with a surprise, found out about the plants that they use for metformin, and they apply the metformin with for diabetes and for other diseases. So we have Carol Tenor. He's the product manager of EMA, and he will talk about that kind of metformin that is made of lilac. Carlo, buongiorno.
Hello, buongiorno, buongiorno. That is a great start.
Buongiorno.
Hello, hello. Can you hear me? 1, 2, 3. 1, 2, 3. Hello, hello. Can you hear me? Hello.
Yes, she can hear you.
Okay.
Yes,
well,
we can hear you.
Thank
We can hear you. Yes, I can hear
Thank you
you.
very
Says
much.
Svetlana.
So thank you very much. I share the video just to make my presentation.
Carlo, just a technical thing.
Yeah.
Please switch to the English channel, okay? Switch to the English channel.
I try to switch again, but I did already.
Because I can hear you in the Russian channel.
Understand?
Because our listeners, that's the bottom of the screen, right?
My computer seems frozen now. I'm sorry for this, but let me check what happened. Why I cannot open Zoom? What happened? I'm in trouble. Sorry, but I don't know how to solve this problem because I cannot see the Zoom any longer, and so I don't have control.
Okay, please write in the chat box if you have experience of working with metformin, so that we understand how deep we should be into the Q&A session when we do. Well, unfortunately, Carlo has failed to vanquish his computer. Okay, he's back. And it's just to remind you that on our platform, we have virtual exhibition section where we can look at the equipment our speakers are talking about, which is GLAD, EMA.
Can you hear me now?
Yes, Carlo, you're back.
It's okay now with the audio video? Hello?
The point is we can hear you from the Russian channel. Could you please switch to the English and mute the original sound, okay?
I did it. I did it already. I don't know.
Well, if somebody has questions,
can you hear me now better? Hello? Hello, can you hear me?
Carlo, we can hear you in the Russian channel. I assume that you haven't switched to the English one.
I have English, which is selected, and then I have to
mute original sound, please.
Yes, attiva l'audio originale. So now is better. Because I don't know which kind of sound I should add. English, it's selected, and then activate or deactivate the original. Anybody can hear me?
Okay, Carlo, you are free to start. We'll talk about metformin.
Very good, very good. Thank you very much. I share the video in order that we can start this presentation at the end. Everything is fine, everything is on air. I have no return. Sorry, someone can me confirm that is on air?
Yes, Carlo.
Yeah, great. Thank you very much. It was a great start from Valentin, and now that we have solved some small, let's say, technological problem, I think that we can enjoy the next 20 minutes talking about a very interesting point, which is an old but still one of the best active ingredient that we have in our pharmaceutical portfolio now. We talk about metformin, and metformin is one of the drugs which is in the top 20 or top 10, we can say, even in the American market, about the treatment of diabetes. Gentlemen, it was a great start, and then it's time to introduce very shortly EMA, which is the company for which I'm working for more than 20 years, which is an international supplier of pharmaceutical equipment, and not only, because we have a large range now of equipment also outside. In special mode, we talk about the EMA Active Division, which is part of a network of different business units, which are following all the activities of the pharmaceutical company. In special mode, this active division is responsible for the manufacturing. So we are following exactly all what you see now on the screen. So handling and washing equipment, granulation in wet and dry mode, tableting coating, capsule filling, and other services. But the scope of this presentation is to talk about metformin. Metformin is the selected the selected product for the treatment of diabetes. And we know, just to resume, that diabetes is a disease which is getting over and over with improved, let's say, capacity of the people to have a more sedentary life or whatever. Always remember that diabetes can be minimized with the diet, with the physical activity, with medication only when it comes to a new point, to a more important point. In any case, at this time, it is estimated that more than 500 million people are suffering. Some of them, unfortunately, with what is called the type 1 diabetes, which is the juvenile or childhood onset. So the diabetes which is generated because the body is not able to produce insulin. And this is more critical than what is called the diabetes 2, even if the consequences are the same. The other is non-insulin dependent. It's the problem that the body is not able to use the insulin which is produced by the pancreas in the proper way. And so this is the reason for which metformin can help in the use of this insulin to minimize the level of glucose into the blood, the amount of sugar into the blood. The way in which this drugs is administered is normally the one that we can see in this table, so mainly tablet, honestly speaking, immediate release tablet. Most of them are film coated in different strength. And the reason for this is that the drug delivery is quite simplified and practical in this form. Most of these are with break line in order that you can easily control also the amount of drug. I remember that the maximum quantity which is normally prescribed is up to 3 grams per day. So you can imagine that you can maybe arrive to this by fractioning also a larger tablet and getting the right amount which is prescribed by the doctors. There is some good point because the typical formulation of metformin is normally constituted by the active ingredient with only few excipients, and those excipients are normally the binder and the lubricant. Only with these three components you can make a tablet. Of course, it is possible also to use other excipient, filler, disintegrants or whatever, but they are normally not required because of the characteristic of the molecule itself. It is normally filmed with the classical, we say, OPA-dry formulation with hydroxypropyl cellulose, maybe plasticized titanium dioxide until it will not be changed over. The manufacturing process is the most classical of the process, in which we start from the dispensing and weighing of the raw material. There is a step of granulation and drying and the blending. This is to produce the so-called primary granule and addition of the lubricant. It may happen that the API present in the original container is agglomerated, and this is most probably the level of complication of this process, because we have to prepare before the first granulation activity the active ingredient for the and this is done by delampers, breakers and other specific equipment which can be used for the pre-preparation of the active ingredient. Then commonly you have a process of wet granulation and drying in the fluidized bed, which are both cases authorized, either using both the equipment or even maybe using only the top spraying granulation. For the blending, this is absolutely something not complicated. As you can imagine, 99% of the formulation is done with the active ingredients, so the content uniformity is more or less granted. The only point is to avoid an overblending because the granule is normally friable and soft and could get damaged by an excessive blending time. After that, you have practically the tableting operation and the coating, and it is here in the tableting where you can see really the good capacity of the granulation system, because one of the index which is used to check the compressibility of a material and the result of the operation performed is to measure this index of CAR that I remember is a relation between the density of the poured of the bulk product or the density of the tapped product. So through this, depending on the level, when this number is high, the flowability will be extremely low. When this will be smaller than, we say, 15% as a limit, we say we are in the good flowability, and so we expect a very nice compressibility. Granules means flow correctly, and the granulation means that is properly done for the tableting, which will be smooth and regular. A large proportion of the metformin tablet, as we said at the beginning, it is film coated because the taste of the active ingredient is not nice, and this is the main reason for that. But as logically, this will give also more hardness, more mechanical strength for the tablet, for the material. It will be easy to swallow because normally I told you it's a big tablet, a large tablet of 600 or 1.5 gram, from 0.6 to 1.5 gram, more or less. I mean, it depends also on the formulation. So let's come. The time is to go now through the real sense of this presentation, which is the case study about the optimization of the metformin granulation. This is something which we wanted to share with the audience because it is quite interesting to evaluate the manufacturing process and to investigate the possibility to improve it for quality reason and also for productivity, because with the small operation, maybe you can obtain completely different result and getting, I mean, business done in most proper way, more proper way. So in this case, the aim of the study was to optimize the process of, we say, of metformin 500 milligram, which had to be adjusted to optimize, of course, the production parameter and avoid especially intermediate action like sieving or wetting, overwetting, to get in one shot to a complete automatic process rather than the classical activity which was done before. But let's enter again the detail of this real operation, which was done with a very important Russian company, where our equipment, Rotomix and ARIA, Eicher mixer, and fluid bed dryer are installed for a quite long time. So the batch size in operation is around 200 kilograms, and then, as we said at the beginning, the ingredients are formally three: the API, the binder, and the lubricant: metformin, K30 PVP, and the magnesium stearate. Strict limit to target the primary granule with a moisture content very strict around 2%, less than 2%, and the bulk density, which is variable from 0.55 to 0.65. These are the target of our job, and we have to keep it together with all the other limits imposed by the registration document. And so, you know, you have to play with the rules which are already done. And so you cannot start from scratch. You have to adjust what is done in the respect of the formula and of the limitation which are indicated by documentation. In this case, the original manufacturing instruction that we found when the customer referred to our technological laboratory were the following. So basically, the AHSMG, so the wet granulator, was loaded by vacuum, and then it was started a dry mixing operation as a consequence, and the wetting was done with a very viscous solution, which was a sort of paste of water and PVP with 50% weight-to-weight. And logically, this was not pumped with a peristaltic pump, but poured straight into the mass with the open lid. Then the wet massing was done with the distribution with the impeller and the chopper, logically. But further of that, also another additional quantity of water was poured to obtain the correct, let's say, condition evaluated by the customer at that time, and prolonging the wet massing time for quite long time. The fluid bed operation was, as a consequence of that, quite complicated mix, because they started with a pre-drying process, arriving to a certain level of humidity. Then the product was unloaded, milled, and reloaded into the machine, and normally also re-wetted with another additional spraying, just to get to the final loss on drying expected by the target level. At the end of everything, the final milling was achieving. So you see, it is a complicated process, and the results were not very, very nice. Major issues that were found was the product overheating due to the fact that they were staying a lot into the rotomix, in the high-share mixer, and the friction of particles was increasing also the temperature. This temperature increase, together with the large amount of water included into the formulation, you got a condensation on the lid, and practically the product was regranulated continuously by this wetting condition, creating a dirtiness of the machine very high, with a lot of product which was sticking all around the lid and the walls. This required to open the machine and to scrape up the material from the surface of the equipment. And so at the end, you need also a washing cycle, practically every 1-2 batches, depending on the quantity of liquid that you added and the quantity of liquid which was then sticking, of product which was then sticking to the wall. It was also this intermediate milling of the semi-dried granule, which was time consuming and also contaminating, because this is done with the open lid and was not very simple. And then the requirement of this additional top spray for the remoistening of the system. Well, what we have done is to make an analysis. At the beginning, in a very peculiar way, I mean, just investigating and collecting all the information about the way in which the product was done and what are the real expectation of the customer. Then we tried, together with the specialist of our laboratory here in Bologna, in Italy, our testing laboratory, start using techniques related with the design of experiment, DOE, and started evaluating a scenario of intervention, which basically were based on the reduction of the viscosity, we're based on the possibility to increase the temperature of this binder, reducing total the liquid addition time, and deliver the amount of the liquid in one step, not in subsequent step like it was done before, but to make all in one to achieve a coarser and denser granule and reduce the massing time required. Creating this condition, the consistency of the granule will be different, the shape, the size of the lumps will be totally different and more homogeneous, and so we will reduce the quantity of product on the wall, and you can eliminate totally the ball scraping because the machine itself has the characteristic to scrape the wall, and so you don't have losses of product due to that. If the machine is less dirty, of course, also the washing cycles will be reduced and advantaged by that. For the drying process, not so much was to be changed, but we imposed or we thought about a reduction of the air flow rate, which is always helpful when it is possible because create less mechanical strength, mechanical stress to the product, and also reducing change in the temperature or useless, because when you change from 35 to 40, 45 is practically the same situation, and so keeping the temperature steady will help to understand also the reaction of the process to the change that you are eventually doing. And this is another tip really to get a better result. Simplify wherever it is possible. At the end, in practice, we have generated a number of conditions which are indicated in this table. It goes without saying that we are not going to read all these sentences, all this information which are here, but I hope that you will have the possibility to consult the documentation together with the after the presentation or whatever. In any case, at the end, you will find our contact. And if you are interested in some specific subject, I am personally available for any explanation you may require. Just in summary, in any case, we started with an original procedure and we arrived to propose two different alternatives. And these alternatives are substantially based on the possibility to use the Watson-Marlow peristaltic pump for liquid distribution instead of the manual addition. Possibility to increase the temperature of this PVP solution to 45 or to 62 degrees in order to minimize furtherly the speed of addition. You see, from 24 minutes, we can arrive up to 12 minutes of the administration for the mass. And then this condition of operation, which allow the fluid bed to be used in a single stop, in a single, let's say, process, in a single step. So basically, eliminating the intermediate sieve and the additional spray, which were losing time and creating not a small problem to the fact. So these are the conclusion. Practically, coarser granule means less dirtiness in the machine. Less dirtiness in the machine means simplified processing. If the machine is clean, you reduce the number of washing cycles required from one batch to the other, eliminating practically and using only the end of campaign washing, which means practically that we have reduced by more or less 3 times the quantity of washing cycle which were required. In the fluid bed, we said that we generate this granule in such a way that the compressibility index of CAR is passing from 26 to 14, and so we have now a complete flowability, which is demonstrated on our Prexima tablet presses, both in the 300, so a single-side tablet press, or the 800, 65 station with a double side. Well, in both cases, we can arrive with a high-speed tablet press to keep a regular feeding of the die and getting results which are extremely stable, both in terms of hardness or weight, all along the process, start 15, 30 minutes, end of tabletting. So these are positive results which are certified also by the investigation done on the process. On this subject, just to resume a little bit, part of the content of my previous speaker, Valentin, and also for the really personal importance which I give to this kind of technology, just a couple of words about one tool which was extremely helpful during our study. And this micro NIR from VAV, one of our partners for the manufacturing operation. Well, this allows to control a number of parameters, which in this case specific of the metformin optimization study, were based on the raw material identification, uniformity of content, particle size check, and moisture content, which have been practically automated with a process analytical technology approach by NIR reading. And in opposite, with the conventional approach, require manual operation, sampling, time to lose, and resources to dedicate for this. The predictivity of the PAT is made evident by graphs like this, for instance, which is obtainable also for other parameters. I selected load, loss on drying, and you see practically what is predicted by the NIR is the red dots. What we measured on this very same sample is in blue. And you see that they are following perfectly the sampling made by the machine with the real continuous reading of the NIR probe. And the same is possible also to apply in many different positions. This is the feeding chute of the tablet press. And even here, you see, we follow the spectra of the material, and we got a perfect homogeneity, which is granting that the material is homogeneous in the upper of the system. This is practically the end of my presentation. I apologize for the little delay, but we had some problem in the starting and whatever. I want to leave a few minutes really to ask if there are questions, and for that reason, I hope that someone can contribute, or I am ready for the reply. Please, Svitlana, if you have any questions.
Carlo, there are no questions in the chat box, so we're going to move on. I'm going to let you go, and we're going to switch to the next speaker because we're already 20 minutes behind the schedule.
Yeah.
I just got one little question. I mentioned that as a binder, you can use the Povidone. But can you use some other binder like starch or methyl cellulose in your experience?
Okay. I got the question. Thank you very much. It's very interesting because there has been a lot of study. Of course, metformin is one of the blockbusters, we say, and so there is a lot of study about. Member of a study made by researchers from a university in India, where they made a comparison of different binders, the most common in pharma, and also, we say, also in non-pharma application. But I remember that together with the PVP, which is often used in most of the formulation in Europe at least, They check the starch, they check the hydroxypropyl methyl cellulose, HPMC, or even the methyl cellulose. And the result was that most are very similar, but in a strange way, maybe it is due to also to the concentration. What is preferred are the starch, K30 PVP, or the methyl cellulose. Be careful with the hydroxypropyl methyl cellulose because that was the one with the poorest result in terms of dissolution rate. So the question, which kind of binder? Many different binders. Check the dissolution rate for the result, and be careful with the HPMC. Any other, Svetlana?
Thank you very much, and we really badly want the next speaker already. So have a good day, have a good work day, and thank you for being with us. And we'll also make sure that the other questions will reach you.
Okay, thank you very much. In the presentation, there are the references, and please, I will be very glad to answer and to contribute. Thank you. Bye-bye, and the seasonal greetings, everybody.
Yes, that's right. All our listeners will get a presentation. The presentation will reach to them, and that's more to the listeners that after the event you will get a letter and recording and the materials of the conference. So Carlo tried to skip over a few slides, but you'll be able to look them over anyway. And if you have questions, please write the editorial staff. And now we're going to switch to our next speaker. This is Diana Salnikova from Tolder Farm. She's a regular participant, and this is why I will very briefly introduce her. We spoke about some innovative constituent of solid dosage forms production together with Valentin, and we asked Diana to switch in and talk. She's expected to do as an expert on what transformations and business models are expecting us in the next year, and what business models should be used for company development in the modern world. So we're waiting for Diana. Diana, you're with us? Yes. Hi, Svetlana. That's good. Then we're going to get started. Right. Good afternoon, dear colleagues. My name is Diana Salnikova, and today I want to demonstrate to you this is a presentation on transformation of the pharmaceutical market and new business models. I'll be glad if this presentation helps you develop in your company development. If you have questions, please ask them. Make sure to ask them. Okay, today the pharmaceutical market in the stage of transformation, and these changes have a substantial influence on what business models shall be used by pharmaceutical companies for their further development. Most companies, from the large giants, global giants, to local pharma manufacturers prior to 2020, stuck into more traditional models of development. In this, and you can see in this slide this particular model until the processes are being done on their own, from R&D to marketing, and that always done by one sole company, no delegation, no outsourcing. And we project that by 2023, 2025, this model will not work efficiently. For good quality and fast development, manufacturers have to improve the productivity of the R&D process and cut down the costs and switch from selling medicines to managing the results. So let's look into what factors influence the transformation of our pharmaceutical market. And the first and pretty important factor is the demographic trends, that's growth of the population, the aging of the population, and higher life expectancy. All of that has pretty much good impact on the pharmaceutical market, on the demandable drugs. And the second factor is expiry of the patents for blockbuster drugs, and we're going to talk later about it because I think that's very important when it comes to the choice of development for company. Number three is more money R&D with reduction of their results because there are more generics, more drugs, and strategic partnership and models should be developed, as well as open innovations. Like pharmaceutical companies don't feel easy adapting to new realities of life because a company is a mechanism. A pharmaceutical company does not have like a 100 people. They're pretty powerful and big, so that to readjust and launch this mechanism, it takes time, and setting new targets and development vector. That will take some time up until the when this will be beneficial. The pharmaceutical area does not stand still, so on the pharmaceutical market, mostly there are two business models functioning. That's a traditional vertically integrated model and the new model that I would like to talk about more. That's strategic partnerships model. Now let's look at the first one. That's a traditional vertically integrated model. And in the slide, you can see the most important processes, which is R&D, development, production, and marketing. It's just to note that this model dominates among the local manufacturers in the CIS countries. For example, in the US, Asia, and the EU, this model is not so popular. So what in this model can slow down a company's development? Let's start from R&D. That is independent search and evaluation of necessary pharmaceutical ingredients. That's an audit of pharmaceutical ingredients manufacture, and also inspection and preparation of documents for the registration of a pharmaceutical substance. Why I'm focusing on this? Because unfortunately, 90% and maybe even more, by 90% even more, pharmaceutical companies purchase substances and excipients and APIs from abroad, and this might take quite a while. And this way, the time influences the optimization of the product's cost. This is why this really slows down frequently the company's development. And next one is actually development. And this stage, this is what makes experience and interestedness of the company matter. That's quality control, that's risk related to the development. And it's just to notice that these particular risks that are developed with R&D, they're not taken into account in the process, and they crop out in the next stages, which slows down the process, and the production is sometimes such that there is no production line for a drug or a production line. The production line is busy and there is no equipment, there is no production for API. What am I talking about for API? We're talking about solid forms and solid product. Today, pharmaceutical companies are actually using the model of API plus finished product to optimize the cost of the product. API use can provide a competitive edge to the product, and most often finished products manufacturers have not their own API, and in this case, there is a model of new cooperation. I will talk about pretty soon. It's not necessary that all the products, all the items that you can see in the slide are inherent to the company. Maybe one of the stages needs correction. Analyze the process of your company. Are there any processes that we can change or improve? And we're going to talk about the following. That's a model of strategic partnerships. If you If you look at this slide, you can notice at this slide that the stages don't change. In other words, the R&D and production and marketing remain as is. The only thing that we're gonna look at is third persons, which means partner relations. And this stage, there could be R&D centers or contract research organizations, auditing units, or the agents looking for ingredients, or universities. In our time, which is the pandemic time, it is very important to delegate the search of pharmaceutical materials or pharmaceutical ingredients to professional companies that will be able to very quickly and in a good quality find and provide all necessary information for one to make a transfer to the next stage. Next stage of work is development, contract research organizations or CRO. They often say that CRO do clinical trials, but CRO makes another abbreviation. That's a contract research organization. And here I would like to talk a little bit more detail because I represent this organization, and really at this stage of the whole process, you can reduce time by much more, and you can optimize the cost of the product. So what is the contract research, contract development? That's a service, turnkey service for a pharmaceutical product, given the production platforms, equipment capacities. It is turnkey development, which is very important. It's important that in the stage of development, you can reduce the time for the study, because we pick up the full pharmaceutical substance and excipients, and we search we search and procure the reference drug, because there is a guarantee for pharmaceutical development, and by equivalence promotion guarantee, we're reducing the financial risks for our partners, and we help market up the quality product. And let's switch to production. Production follows. That's contract production organizations, which is manufacturing organization, CMO or CDMO. CMO is just the contract manufacturing organization. CDMO is contract development, contractual development and manufacturing. And at this stage, why is it comfortable? Why is it comfortable, and why is it beneficial to cooperate with these companies? And that's the fact that to sell certain products, manufacturers have no equipment that we spoke of in the last slides, and there are anti-inflammatory, anti-tumor drugs, and many people don't have any production platform, and they want to sell those drugs. Why don't they hire someone else, either third party, and not have this product? And then there's a marketing is done, that includes promotion. That's by organizations doing, they promote the product, the companies doing so. It's very trendy to sell products in Europe, and this is why we use third parties very much. And the last one, and the sequence of the processes doesn't change. There are process participants that keep changing, and there's outsourcing that crops out very often. Outsourcing companies are in every area, and it gives the possibility to delegate some of the processes to experienced and qualified specialists, along with the risks together with the job, which is a very important factor in this cooperation. But most important thing is that outsourcing company can give time. I'm just in a very big hurry. Let's look at the nearest prospects and how this model could be integrated in your company. I would like to talk about patent expiry for blockbuster drugs. Patent expiry since 2023, 2025. about 107 drugs are expected to have an expiry. Such an expiry, only some of them have been cited here. These drugs were already analyzed by our company, and they have a very interesting position. But I want to say a different thing. When it comes to analyzing the patents that are about to come out soon, we found out that now lead positions are taken by anti-tumor drugs. Take that into attention. And this model of cooperation will be very relevant, very important for such drugs. And another question is, why is it so important to market the product right after the expiry date of the patent? It's very important for the generics because the market is developing and the generics are filling the market more and more. It's not only local companies, but also big pharma companies. Just an example of who uses model that I'm just offering. That's the company Cilially. That's from the traditional integration came to strategic partnership. The company is using a broad spectrum of resources beyond its premises, and it joins the efforts with the other organizations to create R&D programs. For example, the forest research development gives you an opportunity to reduce the R&D costs and manage the risk more efficiently and increase the productivity. It's not the last company that's using what in China. In China here, we also had a new kind of cooperation established. That's Pfizer, company known to everybody, outsourced part of Paxlovid, that's a API, to make a drug for Corona, for the COVID. And one of the companies, it's called ASIP Lab. It's got this located in our city, and there are different companies doing such developments. And we're doing also on this, so we're doing something on this substance for finished product along with them, and it's a model popular in different countries, and our company is not coping, so we need to delegate some part of the job. No, you're optimizing. That's what people think. You're responsible that you're optimizing your company. Now again, to answer the question, why is it important to market the product, to bring it to the market right after the expiry date, patent expiry date? So the two first generic products on after the original get the most profit and most recognition. The imports of the generic product by foreign companies, everyone understands that influences the market value of the product, and that also influences the cycle of commercial activity. The global pandemic, and competition between the companies and quick changes on the pharmaceutical market, quick choice and release of the product will give the company the possibility to take lead positions on the market. We recommend that apart from antibacterial drugs and antibiotics, that many people are paying attention to and choose for development. Please pay attention to cardiovascular drugs, drugs for the nervous system, anti-hyperglycemic and respiratory and anti-tumor. Now let's sum up. For high quality and fast development, the manufacturers need to increase the productivity of R&D processes, cut down the costs, and come from selling drugs to managing results. For generic market, time and quality is the most important engine. Flexibility when choosing a finished product for the portfolio We are expanding the portfolio by novelty. Strategic partnerships will optimize the company performance, bring down financial risks, and accelerate the coming up to the market of the company. Thank you for your attention. Sorry for this much information, and please ask your questions. We're going to help you with pleasure because we're doing the optimization and introduction of this business model into pharmaceutical industries. So we will help you the best we can. Thank you very much. Thank you for trying to fit into the timing. And now, it's as the result of your whole presentation, 3 arguments. Could you name why is it worth for someone to work? Is it worthwhile thing to work with you, your contract company? First of all, time is speed. Number 2 is quality. Because we work on European standards, I think that the market is pretty much headed towards Europe. That's very important. And number 3 is experience of our job, of our work, because we're only doing contract developments. We're not taking any other kinds of jobs, and we're into development. Very right thing. The time is very good argument. That's not a restorable resource that we wanted to value on when it comes to work as well. Diana, thank you very much for staying with us. We're gonna relay all the questions accumulated, and we're switching to the next speaker. And Klaus Steingrover is invited, if I got your name right. Lodige is the company, and today he will talk about coders, with which and vacuum dryers, and just a little bit of a spoiler on hormonal drugs. We're going to have some interesting case.
Hello,
Klaus,
everybody.
it's over to you.
Yeah, hello everybody. Yeah, thank you very much for this very kind introduction. And yeah, today I would like to talk about vacuum shovel dryers. So this is one machine, and you have various possibilities to use this machine. So when we talk about vacuum drying, why do we need vacuum drying? So the main part is always that the boiling point is reduced. So as a rule of the thumb, the boiling point is reduced by 10 kelvins if the pressure is reduced by 50%. So when you would like to calculate it more accuracy, then you have to look in you have to calculate it, but the easiest way is always to look around where the boiling point is and where and what temperatures and pressures normally vacuum drying is taking place. So vacuum drying is taking place in a vacuum or pressure range of about 10 millibars to 150 millibars, and the temperature range between ambient temperature up to 100 degrees Celsius. So these are normally points where you can handle as well substances which may be difficult to be handled under normal conditions. Yeah, what is a vacuum shovel dryer made of? So first of all, you have the drum with an shaft inside for mixing, an inspection flap that you can look inside, a sample taker that you can take samples during the production, a discharge port to empty everything, something to feed your product inside, and a filter unit with a vacuum connection, filter cleaning system, and an insulation that the heat is not coming into your pharmaceutical area. If we look a little bit inside, so you have these filters are of quite importance because the filter area and then the dimension of the filter needs to be adapted to your process. The whole process is measured by a difference in the pressures inside the machine and outside, so that you can really adjust the filter cleaning. And what you have as well when you work under the vacuum, you need mechanical seals to seal your machine. So the jacket is used to introduce the heat from outside. You can heat as well the main shaft if necessary. And of course, what is very important that you heat as well the filter housing, because otherwise you get condensating in this area and you got something like a reflux, which is not nice to have. Yeah, we bring in the heat from the double jacket, and so you have to dissipate the heat within the product. Unfortunately, the less the pressure is, the worse the temperature, the heat is transferred into the product. But therefore, we have the mixing elements, which always bring new product to the wall of the machine, and that the product can be heated then. Below you see the picture that the whole jacket is heated, and it's a nice picture to see that really the heat is coming in to the machine on the whole jacket. If the process requires further heating steps, so that you really need a very quick heating, it's possible to inject steam, or if you need a rapid cooling, which is necessary for some products, you can add either liquid nitrogen or some other things to cool down the machine quite quick. So the whole system is looking like it's not only the vacuum shovel dryer, but you need behind the vacuum shovel dryer something to produce a vacuum. Normally for these processes, liquid ring vacuum pumps are used. And in case there's a lot of solvents distilled off, you need a condenser that not everything is going into your pump. Oh, I see the video doesn't work, but okay, let's just talk about what is going on here. So the first thing is always you have to fill your vacuum shovel dryer either by gravity or vacuum. Then you do the mixing, that all the products are homogeneously mixed within the vacuum shovel dryer. Then the addition of the liquid with the binder system is done. And the last step is, of course, the drying step. To have a closer look to the mixing things, we have here our plowshare mixer elements inside, which are able to distribute all the particles very homogeneously within the vacuum shovel dryer. This is important, first of all, that you really have a good mixture, and second of all, that really the product is changing on the wall. Yeah, then for granulation, you need always to add some liquids inside. You have different possibilities to add the liquid. And in most cases, the liquid is added on top of the choppers. Some viscous products needs to be sprayed from the bottom of the chopper. When there's only need of 1 or 2% of liquid to be added, it's added from the top. And the fourth position to be added, the liquid is from the front end, but this is normally done manually. Yeah, when we're talking about granulation, what kind of possibilities do we have to granulate? The green outlines are the ones we are doing during classical granulation. So we have a chemical reaction, hardening of a binder or something like this. And this is taking place within the vacuum shovel dryer. What kind of chemical reactions may occur within a vacuum shovel dryer? You see here one example. It's the formation of carbon dioxide and natrium citrate or sodium citrate. And this is normally used from your vitamin tablets with this sparkling effect. That is a reaction behind, but this can be used as well for granulation in a vacuum shovel dryer. But there are plenty of different kind of reactions which may take place within these machines. But this one is one of the examples, and I will outline this further within a short case study. So when you produce tablets, you first have to mix all your ingredients. Then the granulation step is going on. Within these effervescence tablets, you have the chemical reaction that some of the sodium hydrogen carbonate and the citric acid is reacting with each other. You have to interrupt this reaction because otherwise you don't have any bubbling effect anymore. At the end of the day, then you need cooling and a milling step, and then of course you have to add some lubricant and tablet pressing, and then it is packed and delivered. And all these steps, which are in the green box, are done within one machine. So you see there are several steps within one process step to be done. Yeah, how does this machine look like? You have, as I have said, the typical ingredients of a vacuum shovel dryer. In this case, product was sucked in by vacuum into the system. The liquid was added from this port. And after mixing, you have a sieve which is installed at the outlet of the machine, and the product is screened during the output of the machine, and later on further conveyed by a vacuum conveyor to the packing station and the like. Behind the wall, so this is within the pharmaceutical area, but within the technical area, you have the engine, the mechanical seal, the vacuum system, pneumatic system, WIP system, and the controls, which is all behind in the technical area. So in the pharmaceutical area, you have only the machine and, of course, an HMI to use this machine. How does it look from the backside? From the backside, you see that there are two choppers inside, which do the granulation and then calibration during the granulation. The filter, which was adjusted in this case to the height of the pharmacist's room, and yeah, this conical sieve from Kunivit, Frevit, and this vacuum conveyor from Hecht. Yeah, this is already what I like to show you. The next pages will give you a short introduction on Lödige and our machines in the pharmaceutical area. And yeah, I don't like to put it out now because we are a little bit behind the schedule. And I thank you very much for your attention. And I'm very happy if there are some questions that I can answer.
Thank you very much, Klaus, for your presentation, and thank you for supporting our strategy. My question will not really concern your presentation, but hopefully it will disclose the potential of your capacity of your company as a supplier of upmarket solutions. Valentin spoke about continuous production. So what solutions do you offer when it comes to continuous production? Have you got any projects you've already done? You may not mention, may not name the companies like Company X and geography, maybe Europe or Asia, and on what product this kind of solution was applied.
Yeah, we as Lödige are within this area of continuous production, mainly the mixing and granulation step, which is done in other industries for decades already. In the pharmaceutical industry, it's relatively new. Our first system delivered to the pharmaceutical industry, and which is running quite well, was delivered 10 years ago. And this is installed in Germany. So it's a continuous mixing when you have really to produce large quantities of whatever. you don't have to handle all these containers and things like this, but with a relatively short apparatus, you can produce hundreds of kilograms per hour, and this is really the step where Lüdige is. So continuous production, mixing and granulating, that is our solutions we can provide to this topic.
Thank you, Klaus. On the chat, we got no questions, so we're gonna switch to our next speaker, which is Ballet, a company sharing its experiences regularly on the pages of the Pharmaceutical Industry magazine, Pharmaceutical Coders magazine. And today we're inviting Robin Meyer, who's a specialist on science, and Valerie should also join us. And next year, he will be regional sales manager. He will take the power of that.
Yeah, so good day, everybody. Thank you very much
Всем добрейшего дня.
for the introduction. My duty today is to talk to you and to explain to you the advantages of our truly continuous granulation and drying units, and to show you also different applications within the pharmaceutical industry about this. And I would like to start directly and to show you a picture of our technology center, which is based in Ennigerloh at our LB Bohle headquarters here in Germany. And this technology center was dedicatedly built in 2015 for all of our continuous granulation technology, to give this a home and to give customers a possibility to see demonstrations and also do trials actually with their own material on different continuous manufacturing topics. You will find the phrase Cubicon several times during this presentation, and Cubicon is the trade name of all of our continuous manufacturing equipment, and derived from this abbreviation, the name is quality by continuous manufacturing, because we will promote and help customers to do continuous manufacturing and to improve their quality by continuous manufacturing. How can such a continuous manufacturing line look like? This is easy. This is a picture of the inner side of our technology center in Ennigerloh, and this is a Cubicon 25 line. It is a continuous manufacturing line from powder to the coated tablets. So you supply only raw powders, and in the end, you have a coated tablet which comes out of the process after less than 1 hour. So we have on one stage feeders which feed the material continuously, and continuous blenders. And on the lower stage, on the left side, we have the possibility to do continuous wet granulation and drying. This will be explained in detail later on. And on the right side, we have the possibility, after blending extra granular excipients, to do the continuous tableting. We use preferably Korsch tablet presses from Germany, from Berlin, and also in the end to do coating of the tablets in a continuous fashion. In between these different unit operations, we have also PAT equipment installed, like NIR, near-infrared spectroscopy, for blend uniformity, for LOD measurements after the drying, and also Raman spectroscopy at the rear end of the coating machine to see the development of the coating thickness over time. And this is not all, because this setup you see on the right side again, this was a Cubicon wet granulation setup, can also be changed to have a dry granulation step. Then we use the Bohle roller compactor at the beginning to do the dry granulation. And we can also do continuous direct compression. Then we would just use one feeding and blending unit to feed and blend the raw materials, the tablet press, and potentially also the coater in the end. And everything is fully automated by LB Bohle, so it's just accessible via one control panel, and you can control the whole line via only one panel, one recipe editor, and one common audit trail and batch report is also generated. But I want to talk more in detail about continuous granulation and drying today, and I want to introduce to you our continuous granulation and drying equipment for R&D. This is a Cubicon 1. This is a standalone and fully integrated lab scale unit consisting of a continuous powder feeder, you see here, consisting of a continuous twin screw granulator, and also for the first time of its kind and the only thing available on the market, the only truly continuous dryer without the necessity to build chambers or to have several dryers in a row and so on. This is here working truly continuously. The throughput of this machine is for sure based on the granulation liquid amount you add during a granulation, but roughly 0.5 up to 2.5 kilograms per hour. Everything can be controlled also here via one central HMI. The machine is fully GAMP and CFR Part 11 compliant and can also thus be used in small scale productions. For example, we are building one of these units at the moment for clinical supply, GMP production. And you will see in the end, also available in a high containment fashion with for OEB5, also with wash in place capabilities. Let me go a little bit more into detail and explain you twin screw granulation. During twin screw granulation, you have two screws, you see them here, which are co-rotating in a barrel. A barrel is consisting of an upper and a lower side in which the screws are rotating. And you add powder, you add liquid. In this screw, you have different kinds of elements, like you see here, conveying, so transport, mixing and kneading elements to give the finished granules in the end the required shape, and also, for example, the required porosity, relative density to influence the tableting process in the end, and also to influence compressibility, compactability, and all these important quality attributes regarding the granules. Furthermore important is a highly precise liquid pump. You see here the pump head and the constant stream of liquid which is coming out of the pump head. Really important for continuous granulation techniques because you cannot allow pulsating pumping of liquid like from peristaltic pumps, something like this. And to explain a little bit more in detail how twin screw granulation is looking like, I will show you a short video to introduce this. So you have the powder feeder here. It delivers the powder to the screws. The screws are co-rotating in this barrel here. Here we can see at the outlet of the barrel how the granules are falling out of it. And once again, powder is delivered. In lab scale, we usually deliver a powder pre-blend. Twin screw granulation and powder liquid feeding, mixing, kneading is done in these screws, and the materials leave the twin screw granulator. But what afterwards? Afterwards, the material has to be dried. And as I said, we do not allow a collection of material and transfer then a few kilograms of material to a fluid bed dryer or something like this. No, it's necessary to have a direct and a continuous drying step. And this can be seen here, the hard piece of this machine. It's a continuous dryer. And the working principle is really easy. Here you have the interface to the twin screw granulator. So wet granules fall onto this meshed bottom plate here. Material is transported from left to right, so from inlet to outlet via a vibrating movement. During this traveling of material from inlet to outlet, the material is subdued to hot and conditioned inlet air. And the material is getting dried over time. And here you have the outlet of the product and the air is let out through this way. This is a truly continuous principle. You have several possibilities to integrate PAT. You have short mean residence times. This means the mean time from material inlet to material outlet is ranging between 30 and 120 seconds. So in this short time, you completely dry the material. And also furthermore important, for a truly continuous process, you need to have powerful product filters. And here we developed something really innovative and also patented it. These are product filters which can nearly last forever because they completely get rid of material when cleaning it. They completely get rid also of highly micronized material when cleaning it. So we let this drying here run several hours with high amount of completely micronized material, and we had no significant no significant increase of differential pressure over the filters. So for those of you who are curious how this material flow looks like, I will start again a video. So on the left, when it starts now, we have the inlet of material. On the right, we have the outlet of material. And here you see the material flowing. Don't get disturbed of these black stuff. I will explain it in a few seconds. First thing I want to show you is the material is really running steadily through the system. And we call it a microfluidized bed principle because the material is just lifted a little bit, like on a hovercraft, like on a hovercraft, and it is not thrown into the filters, not thrown upwards really heavily, because the air is just lifting it really, really smoothly. And via this transport, you see that the material is getting can be dried, and this is with regards to the black granules. We entered a portion of black granules here to the system to show you how the material is traveling through the system. And you see that the material can travel through the system nearly as a plug. You have a really steady movement of material, which also defines the steady and homogeneous drying of material over the process. And this is a huge advantage of this very system. Here you see it's getting a little bit more scientific, different residence time distributions. So these are probability functions of the material. We recorded the outlet function of the black granules when we inserted them via different vibration speeds of the dryer. And in function of these median residence times, we also calculated and measured the residual moisture at the outlet of the process. And you see, what is not surprisingly, that with higher mean residence times, so when we increase the residence time, so by decreasing the speed of the material which is going through the dryer, we can decrease the residual moisture up to one point you see here when the moisture is increasing again. So when we increase the residence time too much, the moisture is also increasing again. Why is this happening? Because when slowing down the speed of the material traveling through the dryer, we also increase the thickness of the granule bed on top of the bottom plate. And then the air cannot go through the material homogeneously again. And so we have a higher standard deviation and we have a higher residual moisture in the end. But what can we do in this case? In this case, we have still several other drying effective parameters, like, for example, the airflow. This can be increased, and also the temperature can be increased to get rid of these problems here. Also, one idea to give you is, depending on the mean residence time, how much material is at the same time within the dryer. And these are only some grams, so ranging from 12 to 68 grams of material are in total at the same time within the dryer. So a really material sparing technology, and the material which is at risk at the same time is really low. This is extremely important when you think about disturbances of the process, and that you do not have to throw away whole batches of material when you see a disturbance, but only selectively a few grams of material. A large importance of this process. We also did a full factorial experimental plan with several formulations on this system, and we changed different process parameters which affect the drying process, like airflow, air temperature, and vibration. So velocity of material going through the system. And the nice thing is, I do not want to bore you with the statistical evaluation, but want you to focus on the right side where we have a coefficient plot. And there you can see that you can not only control this drying process very well, but you can also model this drying process very well, which even further contributes and helps you in R&D, especially when you want to save material for trials and do not want to run several and tens and tens of trials. So you see that you can, like physically clear, really well explain how the airflow decreases the loss on drying, so the residual moisture, how the temperature can decrease the residual moisture, and how you can also increase residual moisture again by increasing the speed of the material running through the system. It's explained in the beginning. I also wanted to show you different applications of this continuous granulation and drying technology and show how you can go from R&D to commercial. You have seen these pictures now several times. This is a Cubicon 1 unit for R&D and for small scale clinical supply. This is in size magnitude correlation how such a dryer can look like for a higher capacity, like for 25 kilograms per hour, like as we have built it for one major German generics manufacturing customer. This is how the line was built up 1.5 years ago during FAT at our site. So as I said, this was a large German generics manufacturer, which so far used single pot granulation technology for their OEB4 and OEB5 products. And they changed now to continuous granulation technology. We call it a bin-to-bin continuous granulation technique. So the customer starts with a premix. You only see the lower side of the container here. Then we go to a gravimetric powder feeder with a premix through the small twin screw granulator you see here. The material enters the dryer. Material gets dried within 1 up to 2 minutes, goes through a waste gate. On top of this waste gate, this is a discharge station. We have a microwave PAT sensor to measure the residual moisture of the material. And depending on the decision of this control system, if the moisture might be too high or too low, so without your out of your specification limits, the automation system can decide if some material needs to be discharged, for example. After drying, the material is getting sucked up via a vacuum receiver through a conical sieve, and you have the finished material ready for tableting, because we can also add the extra granular phase here into the container through the sieve. And within 3 months, the first product was already re-registered for the market production. And so they are already, since a few months, producing really GMP material on this continuous wet granulation line. We can also discuss, when we think about continuous granulation, is it more suited for volume, high volume production, or also suited for high value, so small scale production? And the answer is yes, it is suited for both. So this is a large case study we did for one customer here. This was a 130 kilograms per hour line for a metformin immediate and delayed release production, and also metformin. We did a lot of different studies on this. So talk to us if you're interested in these results. Metformin is a really well-suited API for doing it in continuous granulation. The advantage is you can let the system run for days and days without the necessity to have an intermediate cleaning or something like this, because the product volumes, I have shown it to you, inside the process are so low that you don't have the usually the problem with scraping material away from walls or something like this. And another point is a line which we are building at the moment also for a large German original manufacturer. We will have FAT next year. This is a high containment line, small scale, 1 to 4 kilograms per hour for OEB4 and OEB5 APIs. And they use it in their clinical supply. They will use it in their clinical supply phase 1 and phase 2A to supply materials and to already produce it via continuous twin screw granulation drying, also together with tableting. And how does such a Cubicon 1 with a isolator looks like? Quite easy. You see it on the left and right side. On the left side, you see this isolator around the Cubicon 1. Together in the inner side, we have also a vacuum receiver and a conical sieve. When you just need to have the twin screw granulating and drying portion, the footprint of the Cubicon 1 for OEB5 purposes is decreasing even more. So you see it's a really versatile manufacturing technique suited for R&D, suited for small scale and clinical production, but also for high volume and high value production. This is what I wanted to show you today. We have Cubicon 1 available in Germany, also here in our headquarters for trials. This is possible personally, but you can also send us your material for remote trials, for example. Then we can show everything by camera to you, send you the tests material back so that you are able to evaluate and do the quality control on your material and so on. And yeah, in case of questions, feel free to ask them now, but feel also free to contact me or contact our company with regards for trials or for further information. And by this, I want to close this presentation and to thank you very much for your attention.
Thank you for your presentation. We just got a question that was for email on metformin, but you mentioned that as well. You mentioned the metformin as well. And metformin is pretty much inclined to sticking together and lumping. So in your project that you were talking about, how do you deal with that with lumping and sticking together?
Really good question, because this is a major problem. So the good thing in continuous manufacturing, you can readily and freshly prepare the metformin before the granulation part. So we, for example, have also a metformin crushing station. So this is dedicatedly built for metformin, which we sold to several customers. And directly before granulation, you can do the crushing of the metformin. You can transport it via vacuum to your powder feeders and then directly add it to the twin screw granulation part. And thereby you overcome especially this problem with the metformin, which tends to form solid blocks again. And this is the reason why it's especially suited for this continuous manufacturing and continuous granulation process. Really good question.
Robin, it looks like after your presentation, there should be not so many questions about continuous production. So thank you very much for the video, and it's better to see it once than hearing multiple times. But nevertheless, the question, do you support pharma companies when they make a transition to continuous production? Because we understand that there is a certain gap. There's a lack of specialists.
Yeah, definitely we do this. And this example, which I've just shown you, this Cubicon 25 bin-to-bin continuous granulation line we delivered to this German generics manufacturer, there we did exactly this. So we sent our process experts to help them to transfer from single pot granulation to twin screw granulation. And because of the fact that this generics manufacturer also helped a lot and was really interested to learn it, we were able to make the transfer without changing of the formulation and in only 3 different trials. After this, the process parameters were fixed and it was possible to create this stability batches and also then to do the re-registration of the material for also of the process for several countries. Yeah, and this is an important point also that we can supply help to our customers in terms of process development.
Thank you very much, Robin. Thank you very much for your time that you stayed.
Also, thank you for having me.
We're going to let you go. We'll get to our next speaker, our next company. Thank you, Blaine, very much. And we're going to come to our final presentation. Yuri Lapatuk will make an introduction, who is the marketing manager of a glove company, and the presentation on multi-particulate forms will be made by Dr. Norbert Bellinger. Unfortunately, he wasn't able to join us today, but he courteously made a video record of his presentation. Yuri, good afternoon. Good afternoon, Svetlana. My name is Yuri. I am working for the Russian representative office of GLAD, and I've been here 1 year. A short time ago, we had a change in the team's composition, both in Moscow and in Germany. Many people knew Michael Werner as a GLAD representative in Germany. Now it's Ilya Gorodetsky in Moscow. I work instead of Parkovenko. And we're going to show you the presentation from our specialist, Dr. Norbert Bellinger. about multi-particles. This theme is developing pretty long time, and we've been doing webinars in English on multi-particles. So all the aspects of production, the scaling, all the things are available in these presentations. And if you're interested in this theme, then write to me, and I will send you hyperlinks, and I will add them into our mailing. We do regular different webinars. So if you have any questions, we do not only equipment, but we develop different new dosage forms. If you're interested, you are free to talk to me. And we're going to do experiments in our technological center. Thank you very much. Now it's, I think now we should get over to Norbert.
Today, our topic is multi-particulate and particular, the benefits of multi-particulate formulations. So first item of multi-particulates is the plurality of subunits. Here we have the picture of a tablet. The whole quantity of API is contained in one tablet. On the opposite, micro pellets or pellets. Here the API is distributed on a high quantity of multiple small discrete units. This is the basic difference. Today, our topic is multi-particulates, as always, and in particular, the benefits of multi-particulate formulations. So first item of multi-particulates is the plurality of subunits. Here we have the picture of a tablet. The whole quantity of API is contained in one tablet. On the opposite, micro pellets or pellets. Here the today, our topic is multi-particulates, as always, and in particular, the benefits of multi-particulate formulations. So first item of multi-particulates is the plurality of subunits. Here we have the picture of a tablet. The whole quantity of API is contained in one tablet. On the opposite, micro pellets or pellets. Here the API is distributed on a high quantity of multiple small discrete units. This is the basic difference. That has an impact on some aspects of controlled truck release or truck release. And I would like to show you an example. Metoprolol, 200 milligram truckload released from a tablet, controlled release tablet, and from pellets. And here it's shown like it should be, controlled release over a number of hours until the whole truckload is released from the formulation. And here we see the corresponding therapeutic blood levels in the green zone. Here we would like to end up with, here we have the therapeutic range. If in some case of unintended biting on the medication, on a tablet, it happens that the tablet is destroyed, and instead of a controlled release over many hours, we have an immediate release within minutes. And that means in the blood, we exceed massively the therapeutic range, the green one, and we will have side effects which could be even dangerous for the life of the patient if the drug is dangerous in high doses. So that means dose dumping, this is the technical term in case of biting the medication into pieces, the dose dumping, that's much more risky in case of a tablet when it's bitten into pieces than if we would have multi-particulates. Even if the patient bites on them and some are destroyed, there are so many not touched or damaged that it has no meaning and it's not dangerous. Another safety and efficacy aspect is between one single dose tablet and multi-particulates. The tablet could stay in the stomach for minutes, for half an hour, but sometimes also for 1 hour or 3 hours. So we have a very high variability of residence time in the stomach before it's leaving the stomach and goes into the duodenum and further on. With multi-particulates, a small quantity is discharged from the stomach with every motion of the stomach, and we have a much more reduced, a lower variability in the systemic absorption. And we also have much reduced food effect, which is an important safety and efficacy aspect. And also the risk of damaging the wall of the stomach by a very high local concentration of the drug being integrated in a tablet is reduced when we have multi-particulates which are spread all over the surface of our stomach. So better safety and efficacy with the multi-particulates. We have also advantages with the doses, with dose flexibility with the multi-particulates. Here we see one pellet quality and different quantity of pellets representing different doses in capsules. So that means we can achieve different dose strengths with one single pellet type from children up to the adults. And also for clinical studies, for clinical development, where we need a number of different doses, this is easy to achieve with multi-particulates. They could be manufactured in the way I show you here. We have a starter bead, we have a truck layering liquid, and with our fluid bed technology, the truck is layered on top of the starter beads, and in the following steps, we may apply a seal coat and a controlled release coating, or like in this case, a taste masking. We achieve the final pellets, and they are then filled into capsules in a quantity we need and which represents our final dose. So this is a hydrocortisone immediate release product, which is called Alkindi. When we compare this approach with tablets, We see here 4 different tablet strengths, as we had 4 different strengths with the capsules and multi-particulates. And if you want to have tablets of the same size with different doses, we need 4 different granules. So they are then transferred into the tablets. If we want to have 1 granule only and want to have different strengths of the tablets, we will end up in tablets of different size. So it's easily to understand that the tablet concept for the different dosage strengths is much more complicated than the one with the multi-particulates. Another aspect, a second main aspect, is the particle size, and this is almost self-explaining. The big tablets with high dose drugs, they could have a diameter of 16 millimeters or 2 centimeters almost, and you surely see that these big ones, they are not as easy to swallow as the small particles like pellets, like micro pellets. If they have a size of only less than 500 micrometers, they are very easy to swallow by everyone out of our population. So particle size is something where age matters. We have here a curve with increasing age, and what we all know is the children, in particular the very young ones, the premature newborn babies, they have difficulties in swallowing big particles. So for those, multi-particulates, the very small ones, the micro pellets, they are very feasible. And the same is true for the elderly. People older than 65 or even much older, being sick, having difficulties to swallow big particles, big tablets. Also for those multi-particulates, they are of advantage. The adults or the adolescents, they do not have these swallowing issues, so they can swallow monolithic forms like big tablets, capsules as well. But also for those, multi-particulates are very feasible due to their particular advantages. Another important topic is the drug release profile, and with the multi-particulates we have the chance to tailor our drug release profile in any way we want. So we can have an immediate release as we see it here. We could have immediate release with taste masking. We can have a controlled or modified release. This is a first order drug release profile, a 0 order drug release profile. Here we have some lag times before drug release starts. And here we see a pH dependent drug release as we have it for gastro-resistant or enteric coating. So there are very, very many options to tailor our drug release profile. The importance is, on the one hand, that instead of maybe 3 to 5 doses per day, we have to apply only 1 or 2 controlled release applications. When we give a number of times per day immediate release, it's usually the case that our blood levels exceed the therapeutic range, and every time they do, we have side effects. They are not welcome and they are not convenient. With a modified release profile, we stay within the therapeutic range, and this is, in terms of efficacy, safety, and compliance, the best way how to apply drug product to our patients. Here we see, as an example, hydrocortisone, the one I showed you already. The yellow line is the natural circadian cortisol blood levels, and we have a few peaks all over the day. The highest one is in the morning. And for people who do not produce their own cortisone, we have to give them hydrocortisone therapy. And if this is immediate release, we have, after each dose application, we have a peak which is not ideal because it does not ideally mimic the natural circadian blood level. With a new formulation, with a new multi-particulate, which is now called chronocort, we try to mimic the physiological cortisol levels much better, as closely as possible to the natural circadian rhythm. And here the black line, this is the blood levels as we have them now with a controlled release multi-particulate form. The formulation looks like this. Again, we have multi-particulates, pellets, we have a starter bead, we apply a layer of hydrocortisone and we coat it with a modified release coat in order to get a drug release profile which looks like this drawing here. So we have a lag phase until the drug release starts out of the multi-particulates. So in total, for people who do not produce their own cortisone and who need medication with hydrocortisone, we have one product for the young ones up to maybe 12 years. These are the immediate release pellets I showed you already. And in particular for this population group, we need to modify the dose with increasing age until we finally have found the dose which is feasible for the adults. So in this phase, immediate release product like the Alkindi hydrocortisone is good. This is commercialized meanwhile since a few years. And this year, the controlled release form, the chronocort, has been approved. And this one, as I showed you, is matching the circadian hydrocortisone rhythm very well. And this is the dose for the adults, which has to be taken all over their lifetime. Drug targeting is another important issue and topic. And one disease type is in the colon, like Crohn's disease or ulcerative colitis or irritable bowel syndrome. A medication could be a drug like mesalazine or sulfasalazine or budesonide. These are very classical therapeutic drugs. These ones should be transported into the colon. We see it here. For local activity, most of the time, only sometimes they are absorbed into the systemic blood level. The multi-particulates we have to prepare, they need a colon-specific functional coating, considering the conditions in the colon, the physiological conditions, like the pH, like the bacterial metabolic enzymes, like the fluid volume in the colon. Considering all this, we can prepare multi-particulates who are adequate for such therapy. With our multi-particulates, we cannot only fill capsules, but we can produce a number of different drug products. We could compress them into tablets, like MUPS tablets, like orally disintegrating tablets. We could even combine different drug compounds into one tablet. We could fill the pellets, mini pellets, into sachets, stick packs. We could prepare oral liquid, or we could fill it into a sipping straw for application for children. So there is a very big variety of applications possible. Even gastrointestinal tubes can be used if the patient cannot swallow at all. Here an example with an antibiotic, clarithromycin, which is a very high dosed one, and which is in addition extremely bitter and insoluble in water. So what we have to do is to prepare micropellets which are smaller than 500 micrometers in order to avoid any gritty mouthfeel. They must have a high drug load, and they could be filled into bottles to end up as a suspension in water, or they could be applied with a so-called drinking straw. We need the taste masking before they are applied to the patient, but in vivo, we need a very fast and immediate release in the duodenum, where we have a pH of about 6.8. This is the way how such medication is manufactured. We have a micronized API powder, the clarithromycin. We pelletize it with a particular fluid bed technology, achieve the core pellets having a size of maybe 200 to 400 micrometers, and then with another fluid bed technology, we are going to coat these particles for in the first step with a seal coat, and in the second step we apply then the taste masking. Another topic is high potent drug products. Yeah. And high potent drug products means we have an overall an occupational exposure limit, which is below 100 micrometers, micrograms per cubic meter of air. And the lower these OEL value gets, the more dangerous the drug becomes. And the more occupational safety means we have to apply in order to protect our manufacturing staff. So why do I mention that in correspondence with the multi-particulates? I show you first how tablets are manufactured. We have to weigh the API, then we usually make a granule. We have to dry the granule, we have to mill it, we have to blend it with some other compounds before we come to the tableting step, and finally we coat the tablets. So all these steps here in the red field, they are done with dust in the air, which cannot be completely avoided unless we have complete containment, which avoids any dust. But this is a very expensive and challenging approach. When we look at our micropellets, we do only the weighing under very, very controlled conditions. Then we immediately bring the API, the dangerous stuff, into a liquid. We prepare the drug liquid, and the following steps like drug layering and coating, they are not as dangerous anymore. So how could that look like in terms of procedure? We have the weighing in an isolator under highest safety conditions, but all the other steps, they are done in a very controlled but not highest level of containment area. So we do the drug layer, and then we coat the drugs with a seal coat, which can be a water-soluble one, not too functional, but which is hiding the dangerous API. And these pellets, they could again be further processed into capsules or tablets. So the whole thing is much more simpler to do than tablet manufacturing. The last topic I would like to show you in the correlation with our multi-particulate preparations is individual precision polymedicine. So here on this picture, we see a typical medication regimen for multi-morbid patients. And here I show you only 4 different products. I know that there are people who have to take more than 5 up to 10 different pills or tablets or capsules per day. With the individual precision polymedicine, we would have a much more individualized approach to make therapeutic medicine available to patients. We could much more consider the pharmacogenomic profile of our patients. We could consider the interactions of the different drugs physiologically, and we can consider how can we come to optimal dose and treatment regimen. That means we could prepare for everybody an individual a tailor-made and a convenient to take solid dosage form, which is then patient-oriented, which is easy to take, convenient, high compliance, safe, effective, that could result in an approach that patients can better self-management their drug application. They could reduce medication errors and could reduce non-adherence to therapy. So in total, a benefit for efficacy, safety, and compliance again. That's how it could look like. We have different APIs. We make different pellets out of them. We have here with 4 or 5 different APIs, the bulk pellets, and they could be further transferred into individual medicine for the different patients by combining the needed medications, the needed drugs, and the needed doses in, for instance, sachets. So the multi-particulates, they allow us to produce and to provide modern drug products for everybody in our society, children, adults, the older people, also the animals. If you have a challenge in this field, just contact us, then let's discuss, and we are going to find a solution. We are trying to help you all over the life cycle of a product during development with our pharmaceutical services. Thank you for listening.
Well, I think we're going to close. We're going to wrap up, and hopefully the presentations were useful. I would like to thank all the people that asked the questions for their active participation. If we missed something or skip something, please don't take it harder. Next week, we're going to get the materials from the conference, also the records, together with the certificate of participation. Write those speakers directly. We got a list of participants so that you communicate directly, and our online events for this year are closed, and in the next year we're gonna switch to offline, and online things will be requested. So please write to us what you would like to highlight, what solutions and what speakers, and we're gonna get together the right speakers and provide the right solutions, as I spoke before. And watch our announcements, and happy forthcoming holidays. Alles Gute.